My talk today is on the subject of memory and truth. And it becomes important because the question in court is whether someone is accepted as telling the truth when they testify about a memory. And we tested that proposition recently in Napa County, California. What I've particularly enjoyed in this meeting is hearing from my professional colleagues what the professional psychiatrists and psychologists have to say about memory. That it's a construct of several things coming from different directions that sort of create an inference in the person who has what is from your school days. As you remember Aristotle, Hobbes is most famous for the characterization of the human experience as solitary, nasty, brutish, and short. So he wasn't really not a holder of a too high opinion of mankind. But he lived in the 17th century, the 1600s, and he was a great philosopher, advisor to a philosopher. And Hobbes instructs us that imagination and memory are but one thing, which for diverse considerations hath diverse names. Imagination and memory. So we can claim Hobbes to be the father of modern psychology. And he started right off by telling us that imagination and memory are indistinguishable, except for outside corroboration. And that's what I think we heard from the experts over the past day and this morning, that it's almost impossible to tell an imaginative experience from a memory. So when someone claims that they've lost a memory for a period of time, Lewis Carroll asked what happens if the dog loses his temper and leaves. What's left? The answer is nothing, and he says, oh no, the temper's left because he lost it. If you've lost your memory for a period of time, and then it comes back, the question is it really happened, or is it imagination? Or if you're an author, they may say, is it something you wrote, or is it plagiarism? The best poem I ever wrote as a freshman in college turned out to be by Robert Frost. Now, I didn't remember that. I didn't get credit for it either. In our case, we had it's a tragic case. I'm going to turn to it. One of the things about Hobbes is that he wrote during the time of the great wars in England between the Puritans and the provocative in his statements. In fact, so much so that they introduced a Bill of Attainder in Parliament in 1665. And the charge was that Thomas Hobbes should be executed because he caused the plague and the Great Fire of 1664 and 1665 by publication of his atheistical views. Now, along the same lines, the state of Washington has recently adopted a law that repression exists, as a matter of fact, and therefore that memories which have been repressed don't count in the statute of limitations for crimes. I'm reliably informed that the state of Washington now has a bill under consideration that says wife beating is caused by an unresolved Oedipal conflict, and that the remedy is going to be mandatory electroshock therapy. I would say that that latter law is within the competence of the legislature of the state of Washington just about to the same extent as the former law. I don't know whether they have a clue whether repression exists or not. However, we do try and learn from history. And some of you will remember with me that Queen Elizabeth's mother was universally accounted to be a witch and had been sentenced to be beheaded or burned at the king's pleasure. There were laws against witches in the 1600s. They executed 70,000 people as witches. 70,000 people. King James wrote a book, James I, affirming that witchcraft occurred. He later changed his mind. They brought the issue before Chief Justice Matthew Hale of the High Court of Justice. And Hale ruled, there must be such things as witches since there are laws against witches. And it's not conceivable that laws have been made against something which did not exist. So we have memories and we have repression. There's a law about it, and therefore it must exist. I guess it exists in the same sense that the fellow believed in baptism. He said, yeah, I've seen it done. However, I think a lot of it's imagination. Now, what happened to Gary Ramona? Let me just give you a capsule. Gary Ramona was born in Ohio but moved as a boy to California, grew up in Southern California, lived with his parents who were working class folks, met his lovely wife, Stephanie, in junior college, married her the next year. He was a carpenter for 5 years, pounded nails, took a job with Vitapack selling citrus juices. 2 years after they married, they had their first child, Holly Ramona, in 1970. And Gary was working at Vitapack at that time. They bought a starter home in Diamond Bar, California in 1972. And that year Kelly was born, the second child. She was a very nice, pretty child. And then 5 years later along came Shauna, the third girl. Gary took a job with Robert Mondavi Winery in 1971. And that year he was salesperson for Southern California. Mondavi sold 12,000 cases of wine. Gary worked pretty hard. By the time he got canned in 1990, he was vice president of marketing and sales. They sold 12 million cases that year. His salary rose from $1,000 a month to $298,000 a year, plus fringes of another $200. He lived the American dream. He worked very hard at it. In 1978, he finally got a degree at night school at Fullerton State College. He'd been hired by Bob Mondavi, who owns Robert Mondavi Winery, in '71, and Bob had wanted him to move to Napa, California. But Stephanie, whose mother lived in Southern California, didn't want to move. So they postponed that. But in 1978, they did move up to Napa, California, to the town of St. Helena, Napa County, California. And that's where the family grew up from 1978 to 1990. As I say, during that time, Gary Ramona worked very hard, got regular promotions, and supported his family in a very nice style. Holly was a very happy child as far as all of our evidence shows, and we have considerable evidence that we put before the jury about Holly's childhood. That's one of the benefits of the film age. Gary made a lot of family films, and so he had maybe 40 or 50 hours of family film where he could show what kind of a child Holly was while she was growing up. We had the neighbors who lived with the Ramonas in Diamond Bar come to court and testify that Holly was a happy, secure child in those years, and there were no signs of any sexual abuse at all. Some of the neighbors, one of the neighbors, Maggie Haswell, was a nurse who deals with abused children. So there's certain considerable weight that the jury gave to that testimony. Here were the neighbors. The neighbors up in Napa also came and testified to the same effect. Holly Ramona was athletic. She played tennis. She rode horseback. She rode bicycle. She was a cheerleader. She participated in the band. She did a lot of different things while she was growing up. She was a good student, did well in school. There was one possible problem, as it turned out. The possible problem was that when she went to see her pediatrician at 10 days, she saw a wonderful pediatrician named Dr. LAN Clink. And LAN Clink saw her at age 10 days old, and he continued to see her until she attained the age of 8 years and the family moved to California. So he saw her for a period of almost 9 years. And he saw, the first thing he noticed is when he weighed Holly, and he recorded her height and weight, that she was in the 10th percentile of height, and she was in the 75th percentile of weight. That means that you're 75th biggest in the circumference. So her body type is like her father's. That's hereditary. Her mother, on the other hand, is slim. And Holly described her mother as a Linda Walker model for her. I don't know what Linda Walker looks like, but I gather she's slim. And anyhow, Stephanie Ramona is slim, very well dressed. She is, and she's very attractive, but she is thought of by adolescents as being on the chubby side. During the course of seeing her pediatrician, Holly was seen at age 7, and she had persistent urinary tract infections. So she was taken to see 2 pediatric urologists, and there was a voiding cystourethrogram taken. Is put in a table, and her urethra is penetrated with a tube, and they void the bladder, and they x-rayed the process to see if there's some reflux that would cause a medical problem. The child has to be held on each side by a person. The physician has to, or the technician has to approach the child and put his head between her legs to insert the catheter. This procedure was done on Holly when she was 7 years old. We're going to come to it in a minute, but the medical records we later located found that Holly had seen a Dr. Lisbon at age 3, reported she was given enemas every 3 to 4 days for constipation. This is at age 3. So during her growing up period, Holly did have, on the whole, good health, but she had these urinary tract infections, and she also had, later on, well, she had earlier on this constipation. One of the things I asked Dr. Clink, and that was whether or not the cause of, what the most common cause of urinary tract infection is. He said usually it's wiping in the wrong direction. They may contaminate the vaginal area with the fecal flora, which I think is widely known, possibly not as widely as it should be. He saw Holly 26 times in 9 years. And he said 2 annual physicals after she was 5.5 years of age, and when she was also 7, almost 7. He said he did a complete physical on each occasion, which included examination of the genital area. How did you do that? Well, she was a very healthy, cooperative child. He always has a nurse or parent present. The child takes the frog position and he looks at the vaginal area. He later testified that he spreads the lips with one hand and shines a flashlight. He saw Holly for a period of 8 years, including these annual physical checkups, including examination of the vaginal area, the vulva. Doctor, was there ever any hint of sexual abuse you ever observed during your years of treating Holly? Answer, I never saw any physical or emotional evidence. Had I seen or suspicion either one, I would have called the authorities. Then continuing, he said that twice. We asked him that twice. He repeated that twice. And he said he also saw no emotional upset or disturbance that would cause him to have any suspicion of any character. This is Dr. Lisbon's findings or report at age 3 when Holly is having these enemas. That's pretty hard to read. That's the typewritten version. Enema every 4 to 5 days. I asked Dr. Clink whether enemas were traumatic. He said, well, they aren't comfortable. He said he doesn't like to take enemas, and he never had a patient who did. So here we have a young woman who grew up, was on the whole healthy, but she did have a problem with her weight. She went on diets. Her mother dieted, the testimony was. Her mother maintained her weight by dieting very successfully. Holly went on diets numerous times as a teenager. The report from Story and other researchers says that if you go on diet 10 or more times as a teenager, your chances of contracting bulimia or reporting bulimia later in life is something increased by a factor of 5 or 10. So we know that that's a risk factor for bulimia. Holly was on a diet continuously from junior high school all the way up through high school. And she would gain weight and lose weight. She joined Weight Watchers at one time. Holly did not date during high school. She only had one date during her high school years. She did play tennis on the tennis team with her boys. Her younger sister was more popular. She's slimmer. She was a candidate for homecoming queen. So there was some tension there. Holly's mother put a value, as did Holly's father, on Holly losing weight. The mother, in fact, even pasted a picture of a model up on Holly's mirror. But Holly never did meet the aspiration to be an anorexic young woman. She always was a little bit on the heavy side, although her weight did fluctuate from time to time. After she graduated from high school, she chose her own college. She chose her own clothes throughout high school. She chose her own activities. She chose her own college. She wanted to leave home, which is a good move. One of the tasks I understand from our experts of adolescence is separation from the family. So she decided to go to the University of California at Irvine, which is about as far as you can get from Napa, California. And she went there for a year, came home for the summer of 1989. And that summer she worked as a crystal technician at Mondavi Winery. That means she got to wash glasses. And people would come in, they'd pour a sample of the Mondavi wines, which are terrific, and Holly would get to wash the glasses afterwards. So she lived at home that summer, and regrettably, Gary and Steph came home one night and found Holly had been throwing up in the bathroom. And Steph said, "What's wrong?" She said, "I have the flu." But the next morning, she got up and cheerfully ran off to work. So Stephanie suspected something was wrong. We went to see Dr. Barry Grundlin, the psychiatrist. He said, "Well, it sounds like bulimia." Holly burst into tears and said, "Yes, I've been binging and purging. If you eat a lot and then cause yourself to throw up, you binge and purge." Dr. Grundlin was a psychiatrist who was consulting with the Mondavi Winery family, and Gary was an executive of the firm, so he was available to him. So he saw Gary and Stephanie. He told them bulimia is fairly serious, can cause damage to the body, the throat, the teeth. Sometimes bulimics are suicidal. It's commonly comorbid with depression. 55% of people who have bulimia are depressed, show major depression. He said, so you have to take it seriously, but this is something that should be treated in Southern California. He said, I recommend that you go to the University of California Medical Center at Irvine. Be treated in a multidisciplinary way with a psychiatrist, psychologist, and supporting team. He said Holly should go on medication. Doctors Pope and Hudson, who you are at the conference, demonstrated that you have high rates of remission with bulimia if you use one of three medications, one of which is Prozac, which is a uptake reinhibitor for a brain function, and there are two others. They have maybe 60 to 70% remission for people who go on one of these medications, especially Prozac. Chloromipramine is another one. Fluoxetine, I guess, is Prozac, has other trade names. So Dr. Grundlin said you ought to go on Prozac or chloromipramine or something like that. But he said, since you're going to Southern California, I won't put you on it up here, go down there. Well, at this point, Stephanie went to Southern California to be a therapist for her daughter, and she didn't go to UC Irvine. She asked her aunt. Her aunt referred her to a lady at Pepperdine who referred her to March Isabella, marriage, family, and child counselor. An MFCC in California has 1 year of graduate school and MA, 3,000 hours of training, and passes an examination. March Isabella had been a marriage, family, and child counselor for 2 years at that time, or maybe 3, and she'd seen about 3,000 patients during that period of time. 3,000 patients in 2 years. She's purported to be a specialist in eating disorders. She'd taken 12 hours of special study with the Dr. Andrea Kay, who was purported to be a specialist in eating disorders. She said Stephanie saw Isabella first and said, what's the cause of bulimia? The only thing that Stephanie could remember Isabella saying was, well, 70 to 80% of all bulimics have been sexually abused. That happens to be false. We'll go quickly through my slides and I'll show you. We asked Miss Isabella where she got that number. She said she got it from a book by Garfinkel. Paul Garfinkel is a professor at the University of Toronto. He's written many books, 6 books, many in eating disorders, over 100 articles. We produced all those in court. That statistic is not in any of those books and not in any of those articles. It was admitted to be a false statistic in a false report by March Isabella. So she starts off before the therapy by saying 70 to 80% bulimics have been sexually abused. This is before Holly ever saw the woman. Stephanie thinks very highly of March Isabella. She said she's warm, loving. She had bulimia herself. Isabella told her, she recommended her to Holly. Holly went to see her. It's the first thing Isabella told Holly. 70 to 80% of all bulimics have been sexually abused. I'm a specialist in sex abuse. Come see me. I can't prescribe Prozac, but you come to my individual sessions and come to my groups. In my groups, I have eating disordered patients. She's only 60 to 70% of them have been sexually abused. So Holly goes to see Isabella individually and to the group. And she doesn't have any memories of sex abuse at all, notwithstanding this beneficent intervention. Miss Isabella sends her not to a psychiatrist to get Prozac, but to 2 endocrinologists to have her thyroid tested. Well, an endocrinologist is legally authorized to prescribe Prozac, but why on earth would they? That's not an endocrine function, it's a psychiatric function. If, on the other hand, you sent your patient to a psychiatrist who put him on Prozac and they got well, you might not have 2,000 patients in 3 years. They might only last a short while. And in fact, what actually happened in this case, Holly went to see March Isabella in September of 1989. She didn't go on Prozac until July 23rd of 1990. And after she went on Prozac, she got well. Then she went off Prozac and had some more flashbacks. Then she went back on Prozac, and she's still on Prozac, and she's doing very well. So Grunland said go on Prozac, but she didn't. Grunland said go to UC Irvine, but she didn't. She didn't see a psychiatrist until she finally saw Dr. Rose, who was another defendant. Now, so what happened to Holly during the course of this psychotherapeutic treatment? Well, what happened to her is what you might expect. If a person with diabetes presented for dynamic psychotherapy, they could emulate Woody Allen. They could go forever and it wouldn't have any effect on their diabetes. And this didn't have any effect on Holly's depression. She was major depression, nor her bulimia. So she got worse and worse and worse. She binged more, she purged more, she felt worse. She gained weight. Her grades began to drop. She went home for Christmas. She went back from Christmas with her mother and her grandmother to Palm Springs. And on the way back, she had a flashback, which lasted somewhere between 2 to 5 seconds, of her father's hand on her stomach. At trial, we showed 2 photographs of her father's hand on her stomach. One at the beach, holding her up to have her picture taken by her mom. The other at Disneyland, putting her on a ride. So she had a flashback of a hand in her stomach. And she saw her therapist, March Isabella, and she said, well, my father gave me a sexual look over Christmas. And what is a sexual look? Well, Miss Isabella said that's emotional abuse. That wasn't physical yet, he just looked. I said, well, how do you tell a sexual look? She said, well, it's a sexual look, like he would have given her mother, except that her mother and Gary were not on very good terms at that time for a variety of reasons that are relevant, but I won't go into. Here is the information to be supplied about Garfinkel. This is 4 years later. It's still not in there because it doesn't exist in there. This is the deposition we took of March Isabella. Okay, continuing on. Holly had a series of these flashbacks. She had 8 before March. So that's a total memories you may figure, if your arithmetic is still good. 8 times 3 is 24. 8 times 5 is 40. So 25 to 40 seconds of 8 flashbacks. It got increasingly lurid. The last flashback was of her father lying on her with his penis in her vagina. Nothing happens before. Nothing happens during. It's black and white. Nothing happens afterwards. And the age is between age 3 and 8 originally, and later between ages 5 and 8. So she reports to her mother this flashback, which is her mother said, which she says, I'm not going to marry a guy or stay married to a guy who does that to my daughter. She went down and filed for divorce. March Isabella said, well, we want to verify that this is absolutely a memory before you dissolve the family. So let's do a sodium amytal interview. We want to do a sodium amytal interview to verify that this is absolutely correct. So they schedule her for a sodium amytal interview at Western Medical Center in Anaheim. The scheduling is done on March 6th. The interview is to be done by Richard Rose, MD, a board-certified psychiatrist who's never seen Holly. To the hospital on the 12th. Rose sees her first on the 13th for an hour. We give her sodium amytal on the 14th. Rose says in the sodium amytal that Holly couldn't identify anything. It was all very vague. But Isabella has an elaborate account of what happened. This is the hospital record by Darrell Steinmetz when she got to the hospital. She said she was going in for an amytal test. That's what Rose's note shows as well. She feels that maybe nothing happened regarding possible sexual abuse. But no, she really wants to go through with the test. So the admitting note shows that's the purpose. And that's what Darrell Steinmetz says. Rose's admitting note says the same thing. Says she isn't sure. What does Isabella say about that? Question, is it your understanding that sodium amytal interview is completely accurate? I've been told that it is accurate. You can lie under it, but you have to be trained to lie under it. That's false. Who told you it was accurate? The psychiatry profession. Who? Give me the names of the psychiatrists. Okay, Dr. Richard Rose. Rose denied he told her that. But Holly said Rose told Holly that too. You can't lie under it unless you're trained. So, we put her in the hospital for a sodium amytal interview, conducted by Rose. It's not taped before, it's not taped during, it's not taped afterwards. Rose says she remembers nothing. Isabella made up a list of 10 sexual rapes that she said Holly had reported in the sodium amytal interview. 10 specific items. We went through them at trial with her. I said, where is this in your notes? She said, well, she remembered it all before the interview. I said, well, where's this in your notes? Well, that's not there. Well, where's this in your notes? Well, that's not there. Well, do you agree with Dr. Rose who said it was all very vague, he couldn't identify anybody? Oh, no. She remembers he came in the bedroom and took off his clothes and took off her clothes, and he also remembered that his father had been raped by his mother had been raped by her 2 brothers. He remembered that during sodium amytal, which is complete patent nonsense. The mother, Garnett Ramona, testified that that's total nonsense. How could it be a memory? It never happened. It's complete nonsense. After this, she verbalized that the amytal wasn't what she expected, NA's sodium. She is not sure still that everything she said was true. I met with patient one-to-one to discuss feelings. She wasn't entirely convinced that she didn't lie during the amytal test, but after being reinsured by doctor, therapists, and staff, she did not lie. she felt much better. She's been told you can't lie unless you're trained. Did you lie? She doesn't remember what she said. They told her what she said. They reassured her she wasn't lying. How on earth did they know? Sodium amytal, she got 700 milligrams, which is a massive dose. The half-life is 18 to 40 hours. Isabella told her what she allegedly said after the interview that same afternoon. The next morning, she told her the same thing 3 times. She told it to her separately. She told it to her when her mother Stephanie came in. She told it to her the 3rd time when Gary came in. Expert witnesses, Holly was still intoxicated during these 4 sessions and during the confrontation with Gary. Confrontation with Gary was a total disaster. Nobody told them they were going to have a confrontation. They said, would you come up? He came to Western Medical Center, walked in the room. There was Holly. There was Isabella. There was his wife, who hadn't even told him she was coming up. He thinks that Holly's attempted suicide. He's been told by Grunland they're suicidal. He gasped. He burst into tears. He said, well, what's this all about? Mark said, well, we're here to talk about something. What is it, Holly? Holly said, well, you were never there when I needed you. All you care about is your business. All you care about is yourself. I bet you never read a book on bulimia. Long pause. And what else, Holly? Well, when you raped me. Gary says, this is crazy. That's not true. He says, what on earth are you talking about? When did this happen? What on earth's going on here? What are you talking about? Well, Holly never says another word. She turns to Isabella and says, where do we go from here? Isabella then makes up a whole series of events, none of which are reported in her notes. Gary comes in the bedroom while at night. Well, he said, well, where's Kelly? The girls live in bunk beds. Kelly and Holly, or Holly and Kelly. I forget. Anyhow, where's Kelly? Well, we don't know where Kelly is. Well, where's Stephanie, my wife? Well, she's playing tennis. Well, tennis at night? Where? Well, maybe she's getting her hair done. Well, I come home, and Stephanie's out, and there's nobody home. I got 2 young girls. Who's taking care of the kids? Well, we don't know who's taking care of the kids. You mean I go in the bedroom, nobody's home, I rape Holly? This is nonsense, he says. What on earth are you talking about? This is crazy. Well, after 45 minutes of this, Isabella says she's collapsed. They walk Holly back to her bed, and Stephanie says, don't come home, pick up your clothes and leave. You'll never see your kids again unless you confess. Steinmetz confirmed that they reassured her she wasn't lying. Rose admits it. Isabella admits it. That's the rape by the brothers. Then after this, these fantasies got more and more bizarre. She still wasn't on Prozac. She finally had a fantasy that her father was holding the family dog while her father was naked and the dog in front of him. Then she said, had another flashback of her father holding the dog and forcing Holly to orally copulate the family dog. So you're seeing a perfect example of what Dr. McHugh described this morning. You get these increasingly bizarre, implausible, ridiculous fantasies. And then, as I say, she finally went on Prozac, and she finally improved. Now, then they had another great expert, Lenore Terre. And I'm going to, since I've outworn my welcome, be brief. Terre has some wonderful theories. Her 3-year-old daughter wouldn't play Ring Around the Rosie when she was 3 because she remembered that from the Great Plague 400 or 500 years prior, that it was a game about the Great Plague where everybody fell down dead. So that's why her 3-year-old these days doesn't play Ring Around the Rosie. Here's Lenore Terre on Unchained Memories. Here's her testimony, or her statement about Susan Nason, who, as you recall, was murdered. The guy was convicted at the trial. Terre says there was sperm in Susan's vagina. This is her book, Unchained Memories. Here's the coroner's report. There were no discernible organs in the abdominal cavity. Body had been out there for 3 months, had been eaten by animals, and was decayed. There's nothing there. There were no discernible organs in the abdominal cavity. Something else that Terr calls internal or external confirmation. She said that this witness, Eileen, the daughter, playmate, had torn her hair out on one side, the same place that Susan Nason had been murdered by a rock. She tore her hair out. Here are pictures of the daughter, Eileen, from ages 8 through 16. School picture every year for 8 years. No hair torn out. There's another external confirmation from Lenore Terr. What I've put on the screen is what we lawyers call in California under 1709, one who willfully deceives another with intent to induce him to suffer injury or risk is liable for damage. Deceit. What is a deceit within the meaning of the last section is either one, the suggestion as a fact which is not true by one who does not believe it to be true, or two, the assertion as a fact of that which is not true by one who has no reasonable ground for believing it to be true. Any witness will tell you that there is sperm in the vagina and the hair was torn out falls under 1710 sub 2. I now am going to proceed immediately. Terr testified she's treated at least one survivor of satanic abuse. As you can see, here's a book you can get at the store today on how to treat survivors of satanic abuse, and also on how to treat victimized daughters, incest, and the development of the female self from the same publisher. The only thing is there isn't any childhood sexual abuse. The National Center on Child Abuse and Neglect just reported there isn't any. So we haven't had any witchcraft. They stamped that out in the 17th century by executing 70,000 people, except we've now had a recent outburst of it found only by people like Lenore Terr. What the California Supreme Court says about nonsense of this character, he quotes, I'm happy to say, from the Harvard Law Review. Although the Frye test may be difficult to apply and at times may exclude relevant evidence, it has proved its value for over 60 years. It's prevented justice from becoming a matter of amateur guesswork based on unreliable techniques and helped assure that determinations of guilt or innocence are not influenced by vagaries of pseudoscience. Frye is a wise rule that contributes greatly to the integrity of the criminal process. The jury didn't believe Dr. Terr. I'm going to close now. There are dangers of pedophilia. Here's a fellow who loved kids, dangerous man. His name is Dodson. And here are his victims, Alina, Alice, and the youngest child. And what he made them do was listen to verses and stories, and he rode up and down the river with them, and they had picnics with them. You can see how sad they all are later on in life, these young people who've had to listen to these verses. Here's the McDonald family. Look at the seductive pose he takes with the McDonald. The only thing is, there's Mrs. McDonald, which the prior photograph cropped off. It's a nice scene. I don't think it's dangerous. Here's his meaning. Alice says there's no meaning at all. Well, a word says what I choose it to mean, says Humpty Dumpty. This is that same fellow, Dodson. The king says, the queen says, sentence first, verdict afterwards. That's the way they do it nowadays. And then, since Dodson was a logician, he also gave us a standard of proof that's to be used. 'Tis the note of the jub-jub. Keep count, I entreat. You'll find I've told it you twice. 'Tis the song of the jub-jub. The proof is complete, if only I've stated it thrice. Dr. Terr has stated 3 times there's type 2 trauma. What one calls the unspeakable in pursuit of the uneatable, or the incompetent in pursuit of the non-existent. Here are 2 dangerous persons with their daughters. You can see they're thoroughly disreputable looking, and they forced them here to this peak, and they don't have any long socks on or anything like that. So you can see how they're abused by that. The one child stayed back at camp and read. This is the tragedy of it all. Here's Holly's note to her dad. It's the only time Holly cried during the trial. Those are hugs and kisses. Imagination, like memory, can transform lies to truths. Wonderful novelist, Christina Garcia. What are we doing to our society? Fathers can't relate to their daughters. You can't teach nursery school. Grade school teachers are afraid to hug the kids. This is an epidemic. It's a menace. It ought to be stopped. And I'm glad people are standing up to it.